Success in Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome back. You are listening to the Financial Survival Network. It's Kerry, Lutz, and momentous occasion. Another case made it to the Supreme Court dealing with Obamacare, the healthcare exchanges, whether or not the subsidies should be awarded or issued to citizens living in states that did not set up their own statewide healthcare insurance exchanges. Where the court will rule on it is anybody's guess. But in the meantime, you've got to live with it, and figured it was a good time to check in with Dr. Elena George. I'm sure you're familiar with her. She's been on the show many times. A board-certified otolaryngologist, graduate from Princeton, impeccable credentials, and really at the forefront in what's going on in medicine today. And Dr. George, welcome back.
It's a pleasure to be back with you.
I hope I pronounced your specialty right. I never get that otolaryngology, right?
There you go. Yes.
Okay. So just those words just sometimes don't roll off my tongue. So, but nothing about Obamacare rolls off anybody's tongue properly, right?
No, unfortunately. It's been a mouthful of trying to swallow all the things they want to cram down our throats collectively. I hope the Supreme Court does what it should do, which is to overturn this portion of the bill, of the law, I guess you can call it now, because it's not even written into the law. I mean, it's very specific. If you have your own, if your state does not have its own exchange, then you cannot have subsidies. And this has been the modus operandi for the entire time of this thing has been in effect. They've changed the rules. They've jerry-rigged the system to try to make it work when it was never going to work. And when they tell you 8 million people have signed up, it's not even true. Most of the people that's in there are people who lost their insurance because of what the Obamacare mandates were. They had a certain type of coverage, and they had insurance that they were happy with, and they lost it, and they were folded into Obamacare. So I would say it's reasonable to say that a majority of the people in there don't want to be in there, and the people who are in there realize that it isn't cracked up to be what they said it was. They can't see the doctor they want to. They can't afford their out-of-pocket expenses. And from a doctor standpoint, I'm not the only one. There are hundreds, maybe thousands at this point, of doctors who are jumping ship. And now the healthcare system is going to have even more of a problem finding qualified, excellent doctors to take care of patients.
I mean, I just encountered it today, Dr. George. A cardiologist that I see down here, I've been seeing him for the past 2 years. Now he's got a nurse practitioner. Lovely person, nothing wrong with her. But I'd been seeing him. Now I saw her for the entire length of the visit. I guess if there was something really wrong with me, I would have seen the doctor. But now for routine checkups, I don't see him any longer. There's another professional that I'm seeing in lieu of him. And I guess that's what we're going to see more and more is the doctor only is there if there's a problem. Otherwise, you don't see him no matter what. I want to expand on that because that's really important. The healthcare, the face of healthcare delivery has changed. It's no longer the doctor, the one with the years of experience, who's been trained to take care of the hard problems. Patients don't get to see that person. They get to see a nurse practitioner, a physician assistant, and there is nothing wrong with those guys. However, their training is completely different than a physician's training. And the whole healthcare system was set up in 10 years ago. That's the last time it was really used the way it was designed to be used, as a team where the doctor is the quarterback, if you want to put it that way. The nurses and the physician assistants carry out the plan.
That's completely changed. And now under Obamacare, you have algorithms, you have treatment care plans that are centrally based, that it's a cookbook. You follow it based on the person's diagnosis. And to top it off, you will now get dinged and you will be fined, basically, if you don't have an outcome that you're supposed to have based on this system. Human beings don't work that way. If you come in with congestive heart failure and you put on the typical medication, you may not get better. But under this system, if you don't get better in a certain amount of time, or God forbid you get readmitted into the hospital less than 30 days after you are discharged, the hospital won't be paid. The doctor is considered to be a bad doctor, and the system basically rewards and dings doctors and nurses and hospitals for what the government decides should be an outcome. That's ridiculous. It will never work. And ultimately, it's going to mean that the sickest patients will get the least care, because this is capitation. That's what Obamacare really is. It's managed care on steroids. Hospitals and these accountable care organizations get a certain amount of money per year that they're allowed to work off of. So that means if you order a test, if you admit a patient, if you actually use services, it comes out of the pot that you had at the beginning. So, of course, the basic drive is going to be to keep people out of the hospital, keep them out of your office, do as little testing as you can possibly get away with in order to keep the money at the end of the year. And it's shared between the hospitals, the doctors, and the care organization. That is ridiculous. And that means, I can tell you, it's happening already, the sicker you are, the less care you're going to get. You're going to get warehoused. And what you really will end up in is a hospice. That's where the drive is being pushed towards. Not to put you in the ICU, not to do the surgery that you need, but to put you in a hospice, put you on morphine, make you comfortable, and get you off of the expensive healthcare delivery train.
That's just awful. How do they do this? I just don't get it. That basically you're finished and that's it. One and done. Is that it?
Yeah, basically. I'm going to say 40 and 50-year-olds in hospice with things like you need a hip replacement. This is what it's come to. Unless you're in the system, unless you're really sick, or unless you have to access it, you don't get it. And they're trying to demonize anybody who asks a question. And that, by definition, should make people ask more questions. It doesn't make you racist or sexist or any-ist because you have a question about how the system is run. It makes you smart. And at this point, I counsel my patients, you really don't want to get sick if you can help from it, because you don't want to end up in the system. It is now, Kerry, a two-tier system where if it's hospital-based, it's more expensive, it's harder access, it'll completely strip your finances bare, and you'll be lucky if you actually get a proper diagnosis and get out of it. And then there's the free market side called direct pay practices, where and I think there's a big movement of independent private practice doctors like myself who have no interest in ever entering Obamacare land, where I'm going to forget my Hippocratic oath, I'm going to be a tool for the state, and I'm going to be used against my patient. Doctors who know this will never do it. Patients have to make a decision on that.
I mean, I don't want to call anyone the N word, the Nazi word, but this is something like akin to what happened in Germany in World War II, in the run up to World War II, where they made value judgments on the value of each person's life, Dr. George. And
sure.
if they decided that your life wasn't worth anything, then they didn't call it hospice, and it wasn't as quote unquote compassionate as hospice, but they basically just offed you. And that was that, right?
It's a slow walk to a hospice. And I can tell you this personally. I've experienced this with people that I know. Like a friend of mine's dad had a heart attack. He survived the surgery. He had other medical problems, so he was on a ventilator. And instead of them calling an ENT consult for a tracheostomy, they decided not to do that. They wanted, and this is really the most damning part of this man had Obamacare. And as soon as he was stabilized, they actually wanted to transfer him to another hospital. But he had an episode and he was no longer stable, so they had to keep him. But there you go. This is push people into a system, get them stable, and get them out as fast as you can. Instead of doing the right things, this is a 50-year-old guy. I'm actually a 49-year-old guy. And so instead of doing the trach and getting him mobilized and up and about, they extubated him, took the tube out, and he didn't survive it. I mean, he had a feeding tube. It ended up going into his lung. He got pneumonia. It was ridiculous. It was like a comedy of errors of patient care. Patient's family wasn't really in the loop. This is all decided internally, and this is what goes on. So I counsel anybody who's got a loved one in the hospital, you need to be in there and be involved, because now there's a system in place, bioethics, who will decide how aggressive they want to be with your loved one. Whether they'll just give them some morphine to make them comfortable, whether they'll put them in a hospice or call a palliative care consult. And they do that now without asking the patient's family. Just do it. And they end up on hospice in the hospital, and you don't even know what's going on. Next thing you know, your loved one is no longer with you. That's subtle, but it's happening. And I really take offense to that. I mean, I'm a doctor to be an advocate for my patient. I'm not interested in counting pennies and being a cost center. I'm not interested in that. And for any of your listeners who question what I'm saying, Google the complete live system of Rahm Emanuel's brother, Ezekiel Emanuel.
Yeah, sure.
That is what this is based on. And anybody between ages of 16 and about 45 is where all the healthcare dollars should be spent. Anybody who falls outside those parameters, they get a slow walk to a hospice if they're lucky. That's what they think. And he said it himself. He said he didn't even want to live anymore after he was 70. Some ridiculous statement, which I'm sure doesn't apply to him, but it applies to the rest of us.
Of course. It never applies to them. You know how this works, Dr. George.
I do.
It's all about everyone else, never about them. It's a great idea for everyone else, but not for themselves. Just like climate change, we should fly around the world talking about climate change in our private jets and our SUVs, but not for you. I don't mean to get off topic, but we're talking hypocrisy. It's hypocrisy.
No, absolutely. It's cronyism at its worst. And it's being couched as progressive and liberal, and we love everybody. So it throws everybody off the trail, because if you have a question mark, you get just demonized, and they want to shut you up. But when it comes down to, you only have a couple things in this earth, and one is your health. And if someone's deciding that you need to pay for things that you're morally against, one, or two, that you're too old to get the services because you're no longer viable, then there's a problem with that. That's not how our system is set up. And if they really wanted to fix it, they would fix the major problem, which is the big business side of it. The hospitals, the insurance companies, the pharmaceutical industry, who've been gouging people 24/7. I can take a patient to a freestanding operating room and get a 70% discount. And if I do that same procedure in a hospital, in my instance, in one of my hospitals, it's going to cost me $7,000 to walk into the OR for the first hour, just to walk in. I mean, ridiculous. So you're talking about 4, 5, 10 times more what it costs to actually do the procedure, just where you do it. That's where the money's tacked on. And this is the take-home message, Terry. People need to understand that it's not the doctors that's costing the money. And quite frankly, if you stay out of this system, you're going to get better care, cheaper care, more individualized care than you can shake a stick at. And it's here already. You don't have to look for it. If you go to direct pay, aapsonline.org, there is a listing of doctors who do direct pay. I do direct pay. I can name 1,000 doctors across the country where, for example, if you want to pay $50 a month, you get unlimited access to your doctor, unlimited care, and fraction of the cost prescriptions. And they're going to be able to spend an hour with you if they have to. That's a difference in spending $600 to walk in an ER, or they're just going to shunt you off to somebody else and you have to wait online for them too. So that's one option. The other is using a different method of payment.
Right.
Something called Liberty Health Share. I think I've talked about it with you before.
Yeah.
And MediShare and Samaritan. But to me, Liberty Health Share is the most user-friendly because it is designed for people who are liberty-minded, so you don't have to belong to a church. You don't need the letter of a pastor. You can be in a civil union or in a common law marriage, and you can be covered as a couple. It's actually all about providing access. And I've done it. I put my business, my health.
Yeah.
And I know they're going to get it, and I love to see these patients because there's no more middleman.
Yep. It's a great thing. I've talked to them. It's real. You have to examine it very closely because it's a very different model of payment than what we have now with our current insurance things. But basically, unless a lot of people get very sick within that group, you'll get paid.
Well, actually, they actually have a umbrella insurance plan, right? So, it's $199 a month. I think I said it before.
Right.
That's the maximum. That's the highest plan. You pay $500 out of pocket, and it'll cover you at $1 million per occurrence per year. And that means every time you have an issue, you're covered up to $1 million. Well, there's an insurance plan that covers that side, not Liberty Health Share. So they are protected. And the good thing about it is that most people who join it actually are healthy, or if they do have an illness, they're working towards getting rid of it and doing what they need to do to get healthy. That's a different patient population. You have people who are partners in their care who may, y'all want to stop smoking, I want to start exercising, and they actually help you do it. And it's not about denying you care, it's about getting you what you need when you need it.
Yeah.
It is a different mindset.
I think you can no longer be a passive patient and
no way.
Expect that the system is going to just fix you, whatever's wrong with you. I mean, you have to be actively engaged. And in a way, the internet works both ways. I mean, if you're a hypochondriac, it's the worst thing that was ever created in the world. But on the other hand, a little hypochondria is not such a bad thing. You can find out more about potential conditions and then be actively engaged in your health management, and that's a good thing. So the model has changed, and you being an active participant in maintaining your health and improving it is a really good thing. And the plans that you're discussing really facilitate that model, and that's what you need to be looking out for. So, hey,
absolutely. And also, most people need to know that it is allowed under the Affordable Care Act. Most people don't realize that.
Oh, yeah.
So you have an option. If you don't want to do Obamacare or commercial insurance, this is allowed. You will not be fined. That's the key. If this is like starving the beast, right? If you don't enter this system, they have to change it. Kind of what McDonald's is doing. People stop going and eating that crap. Now they're starting to do, organic food, and their stock went up.
Did you see that?
Vote with your pocket. Yeah, I love it. Vote with your pocketbook. Vote with your feet. Because if you expect government to help you and Congress to help you, we'll be waiting forever.
Yeah,
it's never going to happen.
I just have to tell you a great story about that. I hadn't eaten fast food in forever, and I was in a place in Florida. There just was nothing but fast food. I ate some of it. I got so ill, I can't even begin to tell you. I was cursing the place. I'm not going to mention the name of the place, but they do have gold in their logo. And I'm just like, oh, my God, the stuff is that bad. And I just had some French fries. And, now they're not going to use antibiotics in their chickens. All right, that's a good first move. They stopped using that ammonium nitrate slurry in their food, in their beef. And, right, vote with your pocketbook, and we'll get all of these fast food places to stop using stuff that imitates food, imitation food. And that's so important. I mean,
the first level of health, Kerry, I know you know this of all people. It's what you put in your body. It's what you eat. It's your nutrition. If you don't have that, then you don't have any foundation to fight off and ward off anything coming down the pipe. So you really have to make your decision on everything you decide to put in your mouth. I don't drink fluoridated water. My cat doesn't even drink that stuff.
Same here. I bottled water all the way and filtered.
No, I don't even use toothpaste with fluoride in it. There's no study that says this stuff is safe. It gets incorporated into your thyroid. It gets incorporated into your bones. It affects your mentation, your IQ. There's no reason to use it. And if it really did work, we wouldn't have dentists to pull Phil's teeth, with cavities, would we? So something's wrong with that.
Yeah. And you don't have to go to Whole Foods and spend $1,000 a month either.
No.
There's plenty of locally produced food that has nutrients far superior than what you're going to get in any supermarket. I try to avoid the supermarket now at all costs. When I do go to the supermarket, I'm looking for the organic stuff. I'm looking for fresh food there. You stay in the outside aisle of the supermarket. That's what somebody taught me. And it all begins with nutrition. And then you stay healthy. You don't need all these complicated procedures because what is it? 80% of all the medical care you receive in your later years is all things that you could have avoided by lifestyle.
I agree with that. Absolutely agree with that. I mean, you should be. My dad was 90. He was in his garden. He was just totally functional with it. And when he was ready to go, he did it on his terms. He wasn't tubed up. He wasn't stuck in an ICU. And that's the way you should do it. And that means every choice you make now, maybe it's not the easiest one right now. Maybe it is more expensive, but what you get, what you pay for. And right now, if you want to make an investment in your own health, you have to be, as you said, a partner in your care and take an active role. And that also means picking physicians who get it, who aren't part of the system. And I don't want to denigrate my colleagues, but anybody who becomes a staffer or takes a salary from a hospital is beholden to them. They no longer have the freedom to choose what their patient care should be. They have to follow that algorithm, otherwise they'll be removed with peer review. They won't, they'll be removed from the hospital. And if you're independent and you're on taking Medicaid and Medicare and you don't put in your codes the right way, they're going to ding you with fines and they'll put you out of business. So this is not a system it's very mercenary. It takes away doctors' freedom of choice. And if you look at and really ask your doctor how they're feeling, I don't think most doctors will tell you they're happy at this point, except for those who've opted out of the system. And those are the ones you need to find.
Definitely. Hey, Dr. George, just tell us your website, your blog, and how we find out more about you.
Sure. You can go to drelainageorge.com, DRELAINA, George like the man's name.com. I also have a practice here in Atlanta, PeachtreeENTCenter.com. And, I have now become a medical advisor to Liberty Health Share because I believe so strongly in it. And I think if you go to libertyoncall.org and look into it, figure out your options, make a real informed decision so you can take your power back.
Great point. And Dr. George, you're really on the cutting edge here. You're so inspiring because you just haven't let the system get you down. You're triumphing over it. It's just such a wonderful thing to see. We've always got links to you in the show notes to the interview on financialsurvivalnetwork.com. Make sure you sign up for our mailing list. Got a couple of great webinars coming up very shortly, and we will definitely be talking to you again soon. Hopefully we'll get a positive decision on the current lawsuit in front of the Supreme Court, but we're not counting on it. And good luck, Dr. George.
Thank you. All the best.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.